deal. First up, Delegate Poindexter, 1176.
Thank you, Mr. Chair. 1176. This bill right now first, this comes out of the forensic nurse study that the Joint Commission on Health realized all where it was found that travel considerable distances, don't really know where they need to go for exam. Physically, they're taken care of course, by the hospital they go to, lacerations or bruises, things like that. Only 16 of our 122 licensed hospitals actually have forensic nurses. The estimate of the study was about 40% of the victims did not report. There's probably around 10,000 actual assaults now based on 2017 data. We have less than 200 nurses across the Commonwealth, forensic nurses credentialed in our hospital. So that's that background.
Sexual assault nurses. Sexual assault nurses.
Yes, sir. Yeah. I'm not trying to solve the big problem. There's other legislation around to actually get into hiring, training, license, and distribute the nurses around the Commonwealth. I'm trying to do something to help the situation in the short term. It's a simple bill. What it really does is requires the hospitals to report the nurses that they have on staff, their location, contact information, and it requires the health department to post that on the website. Bill has a small fiscal impact, maybe $70,000. Bill passed the House unanimously.
What was it, did y'all put money in the budget?
Yes, sir.
Yes, sir.
That's what I was gonna say.
Move to report it.
Oh, can we just, let's see real quick. Is this, we had a bill on this similar, didn't we? I thought we did.
We had them in the, we had
Forensic
something
nurses.
on forensic nurses that it looks at, there's a couple of things, there's a budget amendment that looks at how we pay them, because it's basically paid out of, I think disability or unemployment now, it's something weird. And so there have been some issues on this, but not
Not directly.
reporting, yeah. not
All right.
reporting.
Anybody speak in favor of 1176? Anybody opposed to 1176? Any questions from the subcommittee?
You move to report.
All right, got a motion, and Senator Sasslaw seconds that House Bill 1176 be recommended for reporting. All in favor say aye.
Aye.
Aye. Opposed? Okay. Thank you, Mr. Chairman. Yes, sir. Next up, Delegate Bell.
This is House Bill 664.
Yes, sir. 664, tell us what it does.
So this is a strange little blip in the law. If you're a first responder, your current law responds to a traffic crash, and you touch bodily fluids, which apparently happens frequently.
Let me interrupt
Yes,
you.
sir.
Did we have a Senate bill on this?
I think we did.
Oh, did you?
Oh,
It's
this is
familiar to
familiar
all
too.
of us,
I
I
think
know, we could be
remember, so
losing our
yeah,
minds.
we did have.
That'd be
But
great.
it does seem familiar.
Yeah,
I think
we
that-
did have.
Again, that was a continuation of the work group that happened surrounding this issue,
Oh, okay.
and this
Okay.
is actually solving one of the.
Right.
Okay, I'm sorry, go
You
ahead.
didn't have this part?
No, I
Oh,
don't.
Okay, I'm sorry, go ahead, go ahead.
So anyway, we did form a work group. It was very complicated, and they found something they could fix right away, and they wanted to work for another year on the bigger picture. The right away part was you're covered in somebody's fluid, and you want to get it tested right away, and there's nobody to give permission. And so if you're alive, you've already given implied consent, so it's actually very easy to do it. When you're dead, you're no longer in a position to give implied consent. It's a weird little lawyer's quirk, but apparently it happens quite frequently with most traffic fatalities, if somebody has got themselves, I mean, they reached in a burning car, they cut themselves, or covered with fluid, they can't get the stuff tested to know what protocols to begin. So this just says, if you're dead, you have given the same implied consent as if you're alive. Ironically, you'd think that'd be easier, but it's harder. They're gonna look at bigger problems
In
later.
Illinois, they just let them vote.
Yes.
So that's the bill. It doesn't fix a big problem, but apparently it comes up more than non-firemen would think. And I'm happy to answer any questions. I'm not aware of any opposition.
I swear to the bill, the language on 49 through 52, we've seen that somewhere this
Yeah,
session.
we had something pretty close to this.
But anyway, okay, anybody speak in favor of House Bill 664? Ed, come on up.
Mr. Chairman, Ed Rose with the Virginia Association of Rescue Squads, and we fully support this bill and appreciate Delegate Bell's work on it.
Anybody else? Anybody by chance opposed to House Bill 664?
Second.
All right, moved and seconded that we recommend 664 for reporting. All in favor say aye.
Aye.
All right,
Mr. Chairman.
done. Next up, Delegate Hodges is, oh my God, there he is, fresh from battle in agriculture committee.
Yeah.
All right,
A couple stars, got 5,000 cuts. Hey, we're doing well then.
you got 1266.
1266, I know this was in Commerce and Labor and ended up with y'all, so back with y'all, which is where I belong, so. Dealing with septic systems, so thank you, Mr. Chairman. I see you like talking water to sewage. Basically. Currently, anyone can pretty much conduct a sewage inspection. So Senator, if you want to come out and inspect our septic. Yeah, but it's whether it's alternative or conventional, pretty much anybody can. And basically, these alternative septic systems, they are very complex. They have humps, they have motors, and they are very complex. And we want to make sure in a real estate transaction, we have the right folks doing it in that sale. So this is a good consumer bill and fairly simple. And it just allows for the qualified folks that are credentialed to be able to inspect those systems in a real estate transaction. So fairly simple.
All right, let me ask you, Delegate Hodges.
Sure.
You've have you stricken alternative?
Oh, yes, we tried, we didn't need, that, I think that was redundant, we didn't
Okay.
need that in there for alternative. And I've got some folks that actually can speak to that too.
Yeah, that's good. Come on up.
It was redundant.
I'm Curtis Buller, I represent the Virginia On-Site Wastewater Recycling
Oh, we've
Association.
talked before.
Yeah.
You're Martha's husband.
Yes, I am.
Hate to out you here in front of everybody.
No, that's okay.
Okay, go ahead.
Essentially, we represent all the folks that are listed in this bill, with both the people that operate, maintain, design, and the soil scientists, as well as the installers. So what we have seen over the past 30 years that I've been in this business is folks that really have no credentials whatsoever are going out and saying, yes, your septic system is great and wonderful. And they have, in many cases that I have personally observed, they didn't even know what the septic system was, front yard or back yard. So what we're trying to fix is saying, okay, if you're gonna do that, somebody's, you're not required to during a real estate transaction. It's both the buyer and the seller have to agree to this.
Well, the bank insists on it most of the time. If you go to a bank, you're gonna wanna, yeah.
Correct. And in trying to protect all the parties involved, what we want to have happen is somebody who's simply qualified to go out there and do this. And I can tell you a bunch of horror stories, but that's the long and short of it.
And in the district, Mr. Chairman, where we are basically the land of failed septic systems on the East Coast, it is much needed.
And I would
With a
add.
number of alternative sites.
I was gonna say, I would add that, the alternatives are much more complex, but this does encompass even the folks. Even the folks that pump septic systems would be allowed to actually do this, cause they are also licensed under the operator
Who
category.
would, I'm sorry, Mr. Moore.
Even the folks that can pump conventional septic systems are embraced in this because they are technically operators and have to be licensed as an operator.
So you were telling me my friends at Boggs Water and Sewage and Bunny Quill and Pump would be able to continue?
Absolutely, yes. We've tried to make it very, very broad, to try not to exclude anyone. And we do appreciate the delegate for creating legislation.
Anybody else to speak in favor of 1266? Anybody want to speak against 1266? House Bill 1266?
Move to report.
Second.
All right, moved and seconded that we report 1266. Recommend reporting. All in favor?
Aye.
Opposed?
Thank you, Mr. Chairman. Y'all have a good day.
All right, next up, Delegate Corner.
Good afternoon, Mr. Chairman. This afternoon I have House Bill 925. What this bill does, it addresses folks who would like to transition to higher employment who are currently on a DD waiver, and provides them with the ability to transition over to Medicaid Works, which means they can earn higher income. Right now, there isn't a safety net. If you look to transition, you have to completely give up that DD waiver and take the risk of not knowing how many hours of support you'll receive when you move to a new program. So this builds in place a 180-day window for them to transition, and then also to reprioritize them if if Medicaid Works program does not work, to get back if it's outside of that 180-day window. be happy to answer any questions you have.
Okay, let's see if there's anybody out there that wants to weigh in. Anybody speak in favor of House Bill 925?
Yes, I did.
Here they come.
Hi. I'm Debbie Bailey. My daughter, Sarah Bailey, has cerebral palsy. She's been in a wheelchair her entire life, but she's very blessed, high IQ. She's graduated UVA. She's a graduate of law school, but she can't seek employment because she is on the DD waiver, which allowed her to go to college, allowed her to go to law school. But now that she's out of school, she's dependent on that assistance that she gets through the DD waiver, but she can only make $17,000 a year and maintain her waiver status. She wants to transition to Medicaid Works, which will allow her to increase her income and maintain her assistance. But to do that, you have to give up your spot on the waiver, make the leap over to Medicaid Works with no guarantee of how much assistance you're gonna get. It's a leap of faith that no sane person would take. She couldn't remain independent. So this bill would really allow her and others to be able to say, okay, if I go to Medicaid Works, this is what I'll get. I'll know exactly how much care I'll receive, so I can make that move. They'll become tax-paying, productive citizens, as well as being able to free up a spot on the DD waiver for someone else who really needs it.
How does Medicaid Works work?
It works very much through the managed care system, just like the waiver systems do. It just allows her to earn a higher level of income, up to $75,000, compared to the 17 that the DD waiver allows.
Someone else?
Thank you. Maureen Hollowell with Centers for Independent Living. We're very much in support of the bill. We work with a number of individuals who are wanting to be employed at a higher rate, but they are concerned of losing their services. Some of them will be able to lose their services, but they need an opportunity to transition and try this without their services, without the fear of losing their waiver slot. But the 12,000 person waiting list is just too risky for people, so this would be a great opportunity for a large number of people. Thank you.
Yes, ma'am.
Tanya Dillon, Executive Director of ARCA Virginia. We're very much in support of this bill for the same reasons outlined. It's about giving people an opportunity that can benefit them and then down the road benefit the state. So thank you.
Any questions from the subcommittee?
Good bill. Move to report.
Second.
Moved and seconded that we recommend reporting House Bill 925. All in favor say aye.
Aye.
Thank you.
Delegate Rasul. I will point out, Delegate Rasul, that of all the bills we have on here, you have to get a contentious one.
Well,
Batter up.
gotta keep it spicy, I guess, at one point or another.
I think these other bills were from the years in which you totally destroyed us in the basketball game. This year we were up there.
Well, thank you, Mr. Chairman, it was quite and Senator Barker, it was quite a good game, that's for sure.
First 39 minutes and 59 seconds were great.
They're great, right? Mr. Chairman,
All right, tell us what you got.
members of the committee, first I have a substitute.
Oh, okay, great.
And the substitute has, in totality from my original, has recommended changes from the Manufacturers Association, as well as the Office of the Attorney General has weighed in, asking us to spell out a few more things. So that is essentially the nature of the substitute has kind of spelled some of the chemicals out a little bit further.
All right, let's get the substitute in front of us.
There's a substitute.
Senator Donovan moves and Senator Barker seconds. We adopt the substitute. All in favor say aye.
Aye.
Substitute's in front of us.
Thank you, Mr. Chair, members of the committee. What we aim to do with House Bill 1257 is ask the board to set maximum contaminant levels for these certain chemicals in our drinking water. What we have found is that these specific chemicals, which are loosely called these forever chemicals, PFAS, chromium, and dioxin, have been found in drinking water all across the nation. These chemicals are likely or known carcinogens that have been found in public drinking water. We're not banning the use of these chemicals by any means. We are simply having the board look at the evidence and set what we believe to be Virginia-based maximum contaminant levels. So these chemicals have been tested all across the United States, and what we have found, Mr. Chairman, is that, or what has been found, Mr. Chairman, is that, for example, in one study, across 31 states, all locations that were tested found contaminant levels of these forever chemicals except for one location, for example. So I've tried to work with some of the stakeholders, and what we have done is make sure that there's plenty of time for the board to be able to gather the information. There's a delayed effective date on it as well, and I'm happy to answer any questions and talk through the chemicals as well.
Let me just ask you this, I mean, doesn't the federal government set these things?
Mr. Chairman, the EPA, these chemicals, many of them have been brought to the EPA's attention, and they have talked about maximum contaminant levels specifically around PFAS. Some of these have been around forever. You might know one of them, for example, the hexavalent chromium is the chemical that was made famous by the movie Aaron Brockovich, which highlighted what happened in one town in California. Unfortunately, we don't have a maximum contaminant level set here in the Commonwealth, and so what we are doing is trying to make sure that we set that moving forward.
You have a question? Senator Donovan.
Whenever you tell me that states are doing something different from each other, especially when it's talking about maximum concentration levels, it does make me nervous, because I think it's hard for business to know how to adapt. It's hard for, everybody to know how to adapt. But I get that things aren't happening nationally, and I also respect that there's a reenactment clause on this. What I don't see, though, is a report back to us. And in parallel to this, we have a study that's going on to look at these chemicals, and I feel like, before we act on this and legislate it, since there is a reenactment clause, we need to have the information that is derived from this if it goes forward, or we need to wait for the study that we passed in the other bill and address this next year when we know the results of that study.
Thank you, Mr. Chair, Senator Donovan. The differences here, and I can certainly appreciate that. What we have done in working with all stakeholders, including the manufacturers, is to ensure that there is a delayed effective date to ensure that the board has a lot of information. There have been countless studies that have produced some of this information, but what we have done, Mr. Chair and Senator Donovan, is to ensure in the actual language that any maximum contaminant levels that are done are based upon research and evidence that has been put forward. So we try to not be prescriptive in the legislation in the sense of setting those levels. And this is broader because the study doesn't cover things like chromium, doesn't cover dioxin. And so while it's gonna look at some of these compounds, there are over 5,000 of them. So what we wanna do is make sure that at least these few, we're asking the board over the next year and a half to come up with the maximum contaminant levels for those. It was a good question and good contrast.
Let's see if there's anybody out there. Is anybody out there going to speak in favor of 1257? Yes, ma'am.
My name is Tyler Madison, and because I get nervous, I'm just gonna read it, it's pretty short.
That's fine.
But Delegate Russell has covered a lot of it, and I appreciate your particular questions. The legislation will set a minimum contaminant level, CL, on several of the PFAS chemicals, or forever chemicals, which is a class of fluorinated man-made chemicals which persist in the environment and in the human body. And they cause a list of diseases to include various cancers, liver, kidney cancer, thyroid disorders, harm to fetuses in pregnancy, the chromium and the dioxin also risk diseases. Most people have measurable amounts of PFAS in their body coming from commonly used commercial and industrial products to include food packaging, microwave popcorn bags, fast food wrappers, cosmetics, household cleaners, furniture, and things like Teflon non-stick pans. And as we've been talking about, some of the states have adopted maximum contaminant levels. The EPA has a recommended level of 70 parts per trillion, and I hope that, well, I'm speaking on behalf of the Sierra Club and also the Virginia Conservation Network that would like for you to support this bill. Thank you.
Thank you. Delegate Russell, does the Commonwealth on other chemicals, I mean, do we have other state standards as opposed, or do we just adopt EPA standards?
Mr. Chair, to the best of my knowledge, we don't have a process where we simply adopt EPA standards.
propose what I believe to be a friendly amendment, and that is that a report comes back to the committees on HWI and Education and Health and the House and Senate, maybe by October 1, 2021, so we can actually see the fruits of that labor and their discernment and looking at the guidelines and making sure that we're up to date before this gets enacted that following January.
Let me, Senator Donovan, you know, this is a delayed effective, not a delayed enactment. I mean, a delayed, yeah. Or doesn't have a reenactment clause, is what I'm saying.
No, I understand that, but I mean, if there, I think probably if we're gonna direct this be done,
Sure.
we should probably have an idea, and then obviously the next step after, setting levels is measuring. So this is gonna be a subject of conversation, so I think we need to know the results of their discernment and the decisions that they've made on things, and if they have any preliminary information on testing in Virginia, which they may or may not by then, but, I do get that it's not a reenactment clause, so we wouldn't have to reenact the whole bill, but we could, propose other legislation based on the findings, or strike this bill if we think that it should be stricken. But I just think a report back by, if October 1 is amenable, that gives us time before the session.
Okay, I'm sorry.
I'm sorry.
Douglas, no.
Mr. Chair, Senator Donovan, I think that's very fair. That allows us to make sure that we agree with what's being proposed. So I think we've worked with lots of stakeholders. I wanna make sure that it makes sense for us as well.
And we probably need to as well, excuse me,
Oh,
Mr.
you're fine.
Chairman.
Let me just ask, when you say you work with stakeholders, I mean, are the stakeholders on board, or are they still, as far as you know?
Yes, some of these amendments came from the manufacturers, some of them came, the Attorney General asked us to just spell it out instead of saying PFAS. And so we've worked with everyone that's come along.
Senator Barker, you got a question?
Yeah, just kind of a little bit of an observation and a question. I mean, I think that it's important to take things like this and move forward. I've tried a few of these types of things in some areas where the federal government wasn't doing things in the past. You know, sometimes, a couple of situations took 5 or 10 years to come around and actually step up to the plate and develop their own standards on it. I think it would be worthwhile getting something done. Given that you're talking about a relatively small number of specific chemicals right now, at least, would it be feasible for the Department of Health and Board of Health to be able to do the study between now and, say, November 1 of this year, so that we have information coming into the session next year and move forward on the next standpoint?
Mr. Chair, Senator Barker, I would love the opportunity between the end of session and while it's on the governor's desk to work with them to figure out if there is a better timeline there.
Right.
This is the timeline that I have in good faith agreed with the stakeholders on. I think that it's a very friendly amendment to say they should report back on the findings. Of course, I would love the findings to come back quicker, but I think them reporting back is fine. And if we come to some other consensus, and I will make sure that it is a consensus, of course, in the interim, we'll certainly can maybe make that adjustment with the governor.
Senator Donovan?
We could just ask for an update this year, in
Yeah.
November, so that we know where they are without the expectation they have to complete it and then have a final report maybe the following October, that's amenable to you without any pressures. I think that it's gonna be hard for us in many ways to wrap our heads around it. We're gonna have to look at it and make sure we have buy-in and we all become a little bit more educated.
So you're off that as an amendment, right?
Yes, sir, so I'm amending my amendment, that we'll get a report this November 1, and then a final report by October 1, 2021.
Okay, everybody in favor of that amendment?
Sure.
Okay. Can you work that up for us? All right. I believe, anybody, anything else? Anybody wanna,
Oh, move to report as amended.
all right, moved and, what was that?
Second.
Moved and seconded that the bill be recommended, reported as amended. All right, all in favor say aye.
Aye.
Aye. Opposed? All right, Delegate Pursuit.
Thank you, Mr. Chairman.
We're out of patrons. She is, okay, good.
I feel like I could speak to Delegate Mullins' bill.
Well,
wording is kind of creepy and weird. But it's just a definition change in that is probably an up-to-date one in the code, which changes dead body in any state of decomposition to from the condition of which it reasonably may be concluded that death occurred. Why he has to do it, I don't know. But,
Might be good to hear that from him, I guess, all the past hundreds of zip and other body. You've not heard anything from Mullen's office? Okay. Okay. Tell them it'll take him like, we think it'll take him 15 seconds, it's quicker than the elevator ride. Okay. Delaney, you wanna go
Hello.
ahead?
I did not take the elevator ride, so I'm only trying to catch my breath.
Okay.
I ran.
Did the Stairmaster?
I did. Oh, I'm sorry, can you? Yes. That's probably not bringing in there, if you want to speak through that. Sorry.
All right, let's talk about your 808.
Yes, HB 808. So to give a little bit of background, quick background for the committee, Mr. Chairman, I had asked for a study to be completed last year about the state of forensic nursing in the Commonwealth. And there were a number of really dire findings about that situation. And so,
Now, it's not doing this.
yes.
Do we have a Senate version of this?
No, this one we do not. I know, I wish it could be that easy.
No,
We had a Senate version on some other things. I know Senator Barker was.
The topic is so familiar to us up here, we're all sure we've heard
Yes.
some of this.
I was doing forensic nursing today. so-
That's right.
Okay.
I have a few bills in this space. I used to work as a sexual assault crisis counselor, so this is an issue that's really near and dear to my heart. But in that study, there were some incredible findings, of which we've had several pieces of legislation, but it also began a conversation with the hospitals about just some of the needs for improvement that I think through this legislation, we're gonna be able to allow them to start building more of a framework around that. So some of the issues that we've worked on the hospitals with involve transfer plans, training and treatment requirements, as well as creating a task force. Now there is a amendment that I have before you that was some additional feedback that we got from one of the hospital systems in Virginia that currently operates a very robust program for forensic nurse examiners. And so I do have an amendment before you that further clarifies the treatment and handling of physical evidence recovery kits. So if you, I don't know if you wanna move the amendment first, but. Or adopt the amendment.
These line amendments here, or 5 of them, I guess, there's everybody else, 8 line amendments that are there. Anyone wanna make a motion to adopt?
Move the amendments.
That's what I did. Okay, all right.
Second.
All right. Any discussion, questions? All in favor say aye.
Aye.
All opposed, no. Amendments are adopted.
All right, so I can quickly run through kind of what we've established with this bill. Know that this robust plan is something that we really built in conjunction with a lot of our hospitals who provide this kind of care, in recognizing what type of framework they would like to see so that we can be offering consistent care and service across the Commonwealth. So one issue that's been universally identified is the need for transfer plans. Oftentimes a survivor of sexual assault or domestic violence may go to a hospital only to be turned away. And it's not been unusual to find a victim of rape have to go to 3 different hospitals, even near Northern Virginia, before they can find not just the medical treatment they need, but also that trauma-informed care that a forensic nurse can provide, as well as the ability to collect the evidence. And that's, I think, the biggest issue with the injustice of this, is that any hospital in Virginia will give you the care that your body needs. But if you want the chance to press charges and have a rape kit done, or even domestic violence, they can take fingerprints off of a strangulation victim's neck. If you want to be able to have evidence collected that can be used in court, it needs to be done by a trained forensic nurse. So it's about access to justice and equal justice as well.
Mr. Chairman?
Yes.
Just a question. I
So,
thought physicians were able to do the forensic kits as well.
So they are able to complete a forensic kit, and there are situations where both nurses and physicians can follow the steps. But in my work as a crisis counselor, if it's not a SANE nurse or a forensic nurse who's been trained in that chain of custody and some of the criminal justice aspects, those can often be thrown out in court as inadmissible because it wasn't done by a trained forensic examiner.
Senator,
So, does this bill propose to transfer, we have very limited, centers for forensic nursing. And so this would be across the entire Commonwealth, that individuals would have to be transported if we're only going to accept an exam done. I think that there's room, and we've talked about this before with, ER physicians, for a training module to make
Yes.
sure that we have, and historically, before we had forensic nurses, we had nurses that were just specially trained in the ER that, didn't have the same, certifications as forensic nurses. But I just wanna make sure that we have I just wanna make sure I understand the transport component is are only forensic nurses going to be allowed to do the exams?
So it wouldn't be that they could be the only one, there'd still be choice with the survivor when they come to the hospital, but what we need to have is for the hospitals to have a transfer plan in place. And so that will help address those rural hospitals where there may not be a forensic nurse within a long distance, that they would be able to provide the stabilizing care that that victim may need, but then also have an understanding of where is the closest hospital so that transfer services could be arranged. For some survivors, that may mean they drive themselves, because one thing we've identified is that survivors come to 3 hospitals because they're playing a game of, which one's gonna have a nurse. No one knows. The hospital that they just left can't tell them where one is, so they drive to the next closest hospital and encounter the same problem. So it doesn't necessarily require that they're going to physically transport the patient, but it will require that there's a transfer plan in place, which can mean simply knowing where is the next closest hospital that has forensic nursing care available, and be able to work with that victim to be able to have a plan, whether it's the law enforcement that transports them, whether the hospital transports them, or whether the victim transports themselves. But having a transfer plan is something that the hospitals have identified as an important infrastructure that they need to have in place as part of their regulatory framework.
Question for you, taking a look specifically at Northern Virginia, if you go to Prince William Hospital in Manassas or to Reston Hospital Center in Reston, are they likely to have the services there, or are they going to get transferred to Fairfax Hospital?
You'll likely be transferred to Fairfax Hospital in that case, because they do have the FACT program there. That's not to say they may not have a forensic nurse on staff, but in the event they don't, knowing that Inova Fairfax would be the next closest hospital, and working with everyone involved to get that person there and letting them, at a minimum, know that that is the facility closest to them. Because what we are seeing right now is if you live anywhere west of Fairfax or anywhere south of Bon Secours here in Richmond, your access to forensic care is very hit or miss, and in many cases simply non-existent. Right. So the hospitals have asked us to craft language like this so that they can build their own regulatory framework that would allow more consistency in access to care. Mr. Chairman, the next issue is treatment and training. So currently there's no centralized program or standard set in Virginia for those who are performing forensic nursing services for survivors in hospitals. It is a robust training that they go through, so not to misrepresent the incredible qualifications of our forensic nursing here in Virginia, but each hospital system does have their own training and treatment requirements, which are not necessarily reviewed or vetted by any authority within the state. Additionally, there's no provision in state code which addresses pediatric sexual assault services, which requires a very specific set of skills and competency. So this bill will require that every hospital that is licensed shall provide either sexual assault survivor treatment services or sexual assault survivor transfer services in accordance with the plan that's provided. The bill will set minimum treatment services standards, which include appropriate forensic medical examinations, appropriate oral and written information concerning the possibility of infection of sexually transmitted disease, such as including HIV, resulting from a sexual assault, accepted medical procedures and medications for the prevention and treatment of such infection, appropriate oral and written information regarding the possibility of pregnancy resulting from sexual assault, and medically factual, accurate information available about emergency contraception, oral and written information regarding the need for follow-up care, and medical advocacy services that are available, as well as referral for appropriate counseling and other support services. The treatment subsection of this bill also notes that the PERP kit shall be offered, and that the evidence collected in this exam shall be stored, recorded, and reported properly. The last, maybe not the last, a final issue that the bill addresses is it creates a task force on services for survivors of sexual assault. So there's currently in Virginia, there's no body established to help hospitals set best practices to help create and form a policy, treatment standards when all the things that we listed above. So the task force that this bill would establish would require those designated to serve on the task force to develop a model of treatment and transfer plan. They would develop transfer agreements, work with the hospitals and approved pediatric healthcare facilities to develop plans or employ or contact with qualified medical providers. So a lot of the foundation that this bill presents also will be built out with the recommendations of the task force. So we've kind of set up some basic framework of saying hospitals need to have a transfer plan. Exactly what that looks like would be recommendations of the task force. Some of the finer details is something that we would have the task force be able to build on. And then this bill also sets hospital inspection requirements, reporting requirements on those hospitals who have identified themselves as treatment facilities within the Department of Health.
Okay. Anybody here to speak in favor of 808?
Mr. Chairman, members of the subcommittee, Mike beforehand with the Nova Health System, we strongly support the bill, and a lot of these amendments were coming from us, so we appreciate the delegate being so great to work with this entire session. The VHHA also supports this bill.
Okay. Anybody else in favor of 808? Anybody opposed to 808? Questions from the subcommittee?
Mr. Chairman, I have questions.
Senator Donovan.
Could you explain the fiscal impact to me? Because it looks like we've set up, before we even set up the program, we've set up and funded FTEs for inspection and a task force, which seems a little bit redundant. I'd so much rather see that money going to education for forensic nurses. Are we gonna inspect the hospitals in perpetuity or just make sure they're set up?
So probably to answer some of that question, the hospitals may be able to speak to that as well, but I will say the task force is something, I will say there's no fiscal impact for this biennium for this bill. That is one point that I wanna make, that this is simply allowing the hospitals to do, for the task force to exist. So the task force is something that the agency is currently able to absorb. That's something that they're willing to create and to have move forward. So there'd be no fiscal impact for the task force. The regulatory framework that the bill presents is something that we have worked on the hospitals with. They basically come back to me after some initial proposals to say, these are some of the things we really like to see. These are the ways that we feel doing this business, we need to be regulated. And so that's kind of the framework that this bill sets up, recognizing that the task force will also make finer recommendations as far as how they implement some of the finer details on that. And the reason that we do have the reenactment clause on this bill is recognizing that we need to give the hospitals the time to begin now, and in other states that have done similar things, it has taken them a few years to have their task force recommendations and to implement those recommendations. So to further delay would kind of stifle the progress that we'd like to see on this framework that we've developed. And so the delayed enactment clause or the reenactment clause rather, would not affect.
It is delayed.
So it's a reenactment clause is the way that it left the House, because we recognize that if the hospitals do put together this framework and are regulated in the way that they've asked to be, that will require.
This says shall become effective on July 1, 2023.
That's not reenactment, that's delayed.
Delayed enactment.
Yeah, it's a big difference.
Yeah.
Mr. Chairman.
Senator Donovan.
Question for the gentleman from Inova. Trying to understand as I, having sat on a hospital board and endured a multitude of inspections that hospitals have and look at the cost of time, the hospitals ask for inspections on this?
I can't speak to the HHA's component on that. I mean, what I can say is that you have, the way I would answer your question is this. I think you have systems and programs like ours that see 1,000 patients a year, and you have systems and programs across the state that see far fewer. I think the task force over the next 2 years will be able to identify those best practices that come from both of those, and that inspection component can be tweaked going forward as the process moves along. I think that the delayed enactment addresses a
Further
component of that.
Yep, Senator Donovan.
Are there other programs in the hospital that would be a correlative to this, that you have a separate special VDH inspection on? And
That's not something I can't accurately answer that question.
I don't know
the answer.
any. And follow up, Mr. Chairman, you know, the follow-up question to that is, does VDH actually do their own inspections, or do they contract that out like they do with Joint Commission on Healthcare and other inspection agencies that usually do it for them?
Probably the question is like best appropriate to the department.
Who's the health department?
Mr. Chairman, Eric Cody, Department of Health. To answer the question, there are some other programs such as CLIA. It's an independent and separate inspection inside the hospital. As far as contracting it out, no, some of these positions that we're talking about, this requires a review and approval of the plans, which may not necessarily mean an on-site inspection. It may be a bench inspection, but we're gonna have to do that. And then as these plans evolve and transition over time, each time that there's a change to the plan, the way we would interpret it is that we have to be re-reviewing those plans and reapproving those plans. So that's a lot of where that inspection stuff is in. Also, anytime that there's a complaint based on the plans and the other components of the bill, we would have to have the authority to be able to go in and basically review on a complaint basis.
So, Mr. Chairman, I'll just, speak to our, attempt to solve the fiscal issue, recognizing that, we have a pretty robust regulatory framework that we've worked with the hospitals to create, and the task force that will help, kind of fill that out in a response to what I think has been identified as a crisis in access to forensic nursing. And I think to have the number of stakeholders that we've had come together to say, this is what we want this to look like, and, crafting this bill in such a way that, we're instructing the hospitals to do certain things, but, they have been with us along the way in formulating what that looks like and what they would like the Commonwealth to instruct them to do. The cost that would be incurred would eventually, not this biennium budget, but possibly in the future, be that there's projected that they would need employees to be able to do the inspections. But I think the urgency that we have with allowing this framework to move forward is that, we are in a crisis with access to forensic nursing in the Commonwealth at this moment in time. And allowing our hospitals and the task force to begin their work now, starting to implement some of these changes and to build the system that I feel we need in order to not only, treat the victims of sexual assault and domestic violence physically, but to give them access to justice is something that, is urgent, and that I feel we need to begin this process now, recognizing that there may be a fiscal impact in the next budget year, but it is that they need inspectors to look at what we've put together and ensure that we've done it in accordance to the framework that's been laid out. But I do, just want to express the urgency of allowing our hospitals the opportunity to start this process now, and allowing the task force the opportunity to begin this work now, because looking at the state of forensic nursing in the Commonwealth now, if a survivor of sexual assault or domestic violence is being turned away from hospitals at this moment, that means that so many of those survivors are not getting the rape kit done. And when they don't get the rape kit done, it means that they don't have their day in court, but it also means that the person who assaulted them will not be brought to justice. And there's a complete inequity of the way that justice for domestic violence and sexual assault survivors are treated forensically across the Commonwealth. And we have before you a comprehensive solution to get us moving in the right direction.
Mr. Chairman, just one follow-up.
Yep, Senator Gunn.
I think that the only weakness on this is that FISC and the idea of a separate inspection. You have a couple of years to sort it out, but we do a lot of inspections in hospitals already. And I think that there's an opportunity to change that and not make it a standalone extra add-on that we have to do that can really, I also think that what's gonna happen is we're gonna have to develop something new, and then perpetuating it and keeping it at, best practices is not gonna take a lot of effort or inspection.
And
I think it's in the building, so the task force, the immediate action, all of that I'm on board. I'm really concerned about 4 FTEs in perpetuity for an inspection of a single program in all of our hospitals, and then what's the penalty for them? It just starts getting murky. So, but with that, and with the expectation we'll be talking about that more, I'm move the bill as amended, Mr. Chairman.
Moved and seconded that the bill as amended, House Bill 808, be recommended for reporting. All in favor, say aye.
Aye.
Opposed? You're good.
All right, thank you so much, Chairman, and thank you, Senators, and I couldn't agree more. I think it's something we can work on. I tried my best to get that fist down in the few weeks we've been here, but now I've got a year to do it, and more, we'll work it out. Thank you so much.
Delegate Beelzebub.
That's me.
666. huh?
666.
And a dead body.
Did
And
you
a
have-
dead body.
You had to hang on to get that number, didn't you?
So that's exactly how it happened. We were at like 6:58 and then we thought,
Really? Did you? That's funny.
Senator Donovan was actually gonna do your bill for you, but then we wanted to figure out exactly why it's needed, so.
So, this actually, changing the definition in vital records section to include, dead body and removing recently in any state of decomposition is a result of a criminal case that we had down in Hampton about, 3 years now. There was a woman who had, killed her.
I know exactly what you're talking about.
Yeah.
I remember, yeah. Go ahead and tell them.
So,
Yeah.
she had killed her 9-year-old son, Quincy Jamar Davis, and then kept his body in the trunk for a decade.
Oh my gosh.
And a decade. She got stopped by a state trooper on a driving violation, and he searched the trunk and found a desiccated corpse in the back, still wearing a diaper, still in its baby clothes.
9 years old?
9 years old. He'd been horribly abused over the course of the time. He was not fully potty trained. He was kept at my.
Yeah.
I handle this work all the time. Many
Oh.
people do not. I don't need to.
Yeah.
But when we came down to prosecution, Virginia's grave and body desecration statute ends up referring back to this definition, which said recently deceased. And I don't think anybody could make the argument that 10 years was recent. And so charging had to change. And so as a result, Vess and other complicating factors, and she was eventually charged with manslaughter, not the original second-degree murder that was charged. How much time did she wait? I don't remember.
Just
Off the top of my head.
Just curious.
One of my coworkers handled it.
Okay.
I'll look it up and text you.
All right. Anybody speak on 666?
Move
All right.
to report.
All numbers.
Yeah.
The National
All right.
Family Foundation.
Moved and seconded that we recommended reporting. All in favor, say aye. Aye. Opposed? All right, you're good.
Thank you, Mr. Chairman.
Thank you. Hey, that's it for us, guys. Thank you all.